Good afternoon, my name is Lauren Hargrader, and today I'll be talking to you about the nursing shortage that is impacting our healthcare system. So what is the nursing shortage? The nursing shortage is a current nationwide situation in which the demand for nurses exceeds the amount of nurses that we actually have. Today I will be discussing the contributing factors that are impacting the nursing shortage, how it is impacting nurses and patients, and what healthcare employers and nursing programs are attempting to do to address the situation. One contributing factor is that the enrollment for nursing school is not growing fast enough to meet the demand. According to the American Association of Colleges of Nursing, in 2018 there was an increase in enrollment, but not enough to meet the demand. Another factor is there is a shortage of nursing school educators, which is restricting the number of students that can be enrolled in these programs. The 2018-2019 report done by the American Association of Colleges of Nursing shows that more than 75,000 students were turned away because there were not enough instructors, classroom settings, or clinical instructors. Another contributing factor is that a large portion of nurses in the workforce are getting close to the age of retirement. The National Council of State Boards of Nursing did a survey in 2018 and found that 50.9% of RNs are 50 years or older. They also discovered that more than 1 million nurses will reach retirement age between the next 10 to 15 years. There's also the change in demographics. There's an increasing amount in the aging population who require more care. Not enough nursing staff is creating a higher level of stress for nurses, which is decreasing their job satisfaction and causing many nurses to leave the profession altogether. The nursing shortage has a huge impact on nurses in the professions and the patients who are seeking care. One impact it has on patients is that more errors are being made. One of these common errors is a medication error. This is because the nurse-to-patient ratio is unequal and causes nurses to run a higher risk of making errors. Another complication is that there is a higher morbidity and mortality rate. Due to short staffing, nurses are having to work extra shifts and longer shifts, which leads to burnout. Nurses become tired and burnt out, which leads them to being dissatisfied with their jobs and can result in them leaving. According to Bradley University, overcrowded emergency departments is mainly caused by nursing shortage. An overcrowded ED can lead to death, disability, extra procedures, and a lengthened patient stay in the hospital. For nurses, it can create extra stress and lead to burnouts. There are currently different ways healthcare employers and nursing programs are attempting to stop the nursing shortage. According to the American Nurses Association, one of the top things employers can do is manage wages. Bradley University reported that 53% of RNs are satisfied with their salaries. If employers were to increase wages and offer sign-on bonuses, they may attract more nurses. Another thing that employers can do is provide current employees with education and training to become leaders and educators. This can provide personal growth along with being able to help and train other nurses and new employees. Bradley University also reported that employers can participate in seasonal hiring. This can help with busy seasons such as flu season when there's a higher number of admissions or there are sicker people that are coming to seek care. On the other hand, there are also things nursing programs can do to address the shortage. They can provide different incentives for educators. According to Bradley University, 30.5% of the critical issue is related to non-competitive salaries. Programs can raise salaries and provide incentives to bring in new educators. Another thing they can do is improve financial aid. 28% of nurses are still paying on their student loans. Offering more financial aid or adding different repayment plans can help get rid of the financial burden. The final option Bradley University recommends is enhancing distance learning. This will increase the number of people who enroll, especially people who feel they are too busy. In conclusion, shortage needs to be taken seriously. It is affecting nurses who are currently in the profession as well as the patients. It is important that employers and educators take action to help decrease the shortage. Thank you for your time.